The third wave of our reforms is before the Parliament this week. It's before the Senate. It's passed the House of Representatives. And if passed, it will, from the coming Monday, outlaw the sale and the supply of vapes outside of the pharmacies. The Therapeutic Goods Administration has issued very clear standards for the type of vape that will be able to be sold in Australia as a therapeutic product. It will have a prescribed nicotine content. It has prescribed contents on chemicals. It is designed to be pharmaceutically styled packaged, not presented as a recreational product that is attractive to kids. We'll only be able to have 3 flavours: tobacco, mint or menthol. Gone will be the variety of different ridiculous flavours, the combination of different fruits and bubble gums that are obviously designed not to help a hardened smoker in their 40s, 50s or 60s, but to recruit kids into nicotine addiction and from then into cigarette smoking. Last year I made clear this government's determination to stamp out recreational vaping in this country and our determination to take vapes particularly out of the hands of our kids. This was a product sold to our government here in Australia some years ago and governments right around the world as a therapeutic product. A product that could be used by hardened smokers finally to kick the habit, smokers who'd been on cigarettes usually for decades. What we now know, some years down the track, is that this is nothing more or nothing less than an insidious device designed to recruit a new generation to nicotine addiction. And the tragedy is, here in Australia and in so many countries around the world, it is working. About 1 in 6 high school students are vaping. About 1 in 4 very young adults in their late teens and early 20s are vaping as well. And almost every month, new evidence emerges of the health harms that vaping in and of itself is causing to young people, and also of the gateway that it is presenting to cigarette smoking. We know that vapers are around 3 times more likely to take up cigarettes as non-vapers. This week, the Senate has an opportunity to back in our determination. It has an opportunity to do something really meaningful and lasting for the health of young Australians. I want to urge all senators to back in the government's vaping reforms this week.